Welcome back to Helping Today's Woman. Tonight we're talking about a topic that many women don't want to discuss, and that's the whole idea of urinary incontinence or urinary leakage. In our last segment we talked about a specific type of incontinence called the stress incontinence. In this segment we're going to take a little bit of a turn and talk about urge incontinence. This is as Dr. Jarnigan said in the first segment, the go, go, go. Patient that can get to the bathroom and knows every bathroom between here and the mall. So we're going to talk a little bit about some of the ways that we can treat that type of incontinence. So Barry, why don't you give us a little bit of a basic understanding of what urge incontinence is, and then what are some of the basic treatments that we can use?
Okay, again, urge incontinence is when there is some neuromuscular dysfunction at the microscopic level that causes the bladder not to fill properly. So they just can't hold as much as they should be able to. And when they reach a certain volume, and everybody's different depending on the severity of their problem, when they reach a certain volume, their bladder will have a spontaneous contraction and they will leak. And so that's what's called urge incontinence. Okay. And how we treat that, we first start with, you can do physical therapy. Physical therapy works in both types of incontinence.
Okay.
And then you move into medical treatment, and there's a lot of medication on the market. There's 8 to 10 medications currently on the market that can be utilized for urge incontinence. And people go, well, which one's the best one? And it's kind of like, you know, if hypertensive meds and Motrin versus Naproxen, everybody responds differently to different medications. So there's not a best one. It's a matter of finding the right medication for the right person. And so you try that, and there are side effects that can occur with those type of medicines. The most common is dry mouth, and some women can get constipation, and of course the constipation can make the urge incontinence worse. But those are the kinds of medications that we utilize to treat, and some women will do very well on those medicines, and some women will fail on those medicines.
And one of the common complaints that I hear is, Dr. Williams, why are you giving me something that's going to make my mouth dry when I'm already having a hard time with peeing all the time, which makes me want to drink more? So, you know, it's kind of a catch-22 here. We're trying to give you something to help you, but sometimes we make it worse.
That's exactly right, and that's one of the reasons why many women who develop those symptoms just simply don't stay on the medication.
And that's a great point, and that's one that we want to take to the next step, because there is a new device. For years, as a women's health specialist, basically what we had to do is we basically told people, you know what, you're not getting better, there's not much we can do about it. Well, today we've actually got some devices and some new technology that really can treat these patients in a way that we haven't done before. And so I want you to kind of go through this, because I think this device is such an important device. And describe to us what it is, and describe to us in a patient that it would be used in.
In the simplest way of describing it, it is a pelvic floor / bladder pacemaker. And it's made by a company who makes heart pacemakers, and for women who have either had a heart pacemaker or who know somebody who has, it's a little small battery, but instead of going up in their chest cavity, it actually goes into their lower back. And we have a kind of a lower back model here, and you can see here, and this actually ultimately is implanted below the waistline, but above where you sit, and it goes underneath the skin, so everything is underneath the skin, and this permanent wire feeds through there, and we're going to be able to turn this over. You can't do this at home, and it goes out, and it doesn't go into the back, but it comes out into the nerve that goes around and feeds the bladder. So this lead wire lays down right along the nerve, so it modulates the nerve, and so if the bladder is wanting to contract too much, it'll slow it down. This also works in overflow incontinence.
Okay.
So this works in women who are not emptying properly, and it'll help them empty better, which will reduce their overflow incontinence. And so this lays down along the nerve just like that. The exciting part of this, and the timeliness of doing this show today, is we have now moved, this is done in 2 phases, where phase 1 you put the wire in, and in phase 2 you put the battery in.
Okay.
2 outpatient surgical procedures. But now, I don't know if you can get a close-up of this or not, but this is, see how small that is? This is a small wire that we actually can do the test in the office.
Oh, wow, okay.
And so we can do the test in the office with this little small wire, and so we can, if it works, then we can bypass that first hospital outpatient visit and go straight to just one visit in the hospital to put the battery and everything in.
That's great.
So we now can do this in the office, and the ones that we're doing in the office, again, tell me that they really are not, I mean, it's very well tolerated.
Okay.
It's you know, less really than a blood stick. I mean, it's really, you can see how thin and fine this is. It's a really small wire. It goes in under local, it saves, again, it saves the lady from having to have 2 hospital outpatient visits, and we can go to just 1. And so if it works, we put this in, and if it doesn't, then the wire comes out and we try something different.
I have to tell you, I've had patients who've been through this, and for patients who are dealing with urinary incontinence who once thought there was no options, this is a great option. We will be right back after these messages.